How to do a routine trach change. The tracheostomy tube, also known as the trach, should be changed at least every 2 weeks to prevent buildup of secretions or mucus, which can cause a mucus plug. To start, gather the following supplies on a clean surface: the correct size trach tube for your child with the obturator, lubricating jelly, Velcro trach ties, scissors, supplies for stoma care, and a 5 ml syringe and distilled water if your child has a cuffed trach. Pause the video now to make sure you have everything you need. You may also need a small towel or blanket to help extend your child's neck during the trach change. Make sure you also have the following supplies close by and ready in case of an emergency: the smaller size backup trach tube with the obturator, suction catheters, the suction machine, and a self-inflating resuscitation bag. For your child's safety, make sure you always have another trained caregiver to help you change the trach. Before doing the trach change, be sure to talk with your helper about who will be doing which steps. Both you and your helper need to wash your hands with soap and water for 20 seconds, or use hand sanitizer and put on clean gloves. Take the trach out of the package, but make sure you don't touch the end of the tube. This is the part that will be inside your child's airway, so it must stay as clean as possible. Look closely at the trach for any cracks, thinning, or damage. If your child has a cuffed trach, use a 5 ml syringe and distilled water to inflate and deflate the cuff to make sure it's working correctly. If the trach has any damage, get a new one. Thread the thin Velcro tab of the trach tie through the flange or wing of the trach tube. Fold it back onto the cloth part of the tie and fasten it securely. Repeat this step with the other trach tie. Dip the end of the trach in lubricating jelly. Put the trach down, making sure the lubricated end does not touch anything. Lay your child on their back on a flat surface. For babies or children that move a lot, it may be helpful to wrap them in a blanket to help secure their arms and legs. For small children or babies, put a small towel or blanket rolled up under their shoulders to help you see their neck and trach site. For your child's safety, it's important to keep their head and body as straight as possible when changing the trach. Start by suctioning their mouth and trach if needed. If your child has a cuffed trach, deflate the cuff. Your helper will hold the trach in place by holding onto the hub of the trach with their thumb and pointer finger. Do not press down hard on their trach, as this could cause them to cough or gag. Once your helper says they're holding the trach securely in place, undo the trach ties and remove the dressing. You are now ready to change the trach. On the count of 3, your helper will remove the trach tube and you will quickly put in the new one. If it's not easy to insert, pull the trach tube out, slightly reposition your child, and try again. Once you get the trach in, remove the obturator and hold it securely in place. If your child is on a ventilator, your helper will disconnect the circuit from the old trach and attach it to the new one. If your child has a cuffed trach, be sure to inflate the cuff. Perform routine stoma care and put on a new dressing. Dry the skin and put on any creams or powders prescribed for your child. Securely fasten the trach ties. Suction again to ensure the trach is placed correctly. Follow the manufacturer's instructions for how to clean your child's old trach tube and store it for next time. For more information, talk to your child's care team or visit the website on your screen.